እዚህኛው አዳራሻችን ላይ 5 ፔፐሮች ዛሬ ይቀርባሉ። 4 የሄልዝ ሲስተም ፔፐሮች ናቸው። አንድ ከኒውትሪሽን የሚቀርብልን አለ። ፈቃደኛ ሆናችሁ ከኋላ ያላችሁ ወደፊት ትመጡልን ለአቅራቢ ምቹ ይሆናል። አሁን የሚያቀርብልን ፕሮቶኮል አቤል ይባላል። ከኒውትሪሽን ላይ ነው ፔፐሩን ያዘጋጀው። የሪሰርች ታይትሉ ማፒንግ ሚክስድ ሚልክ ፊድባኪንግ ፕራክቲስ ኤንድ ስፔሻል predictions among children aged 0 to 6 months in Ethiopia, a geographically weighted regressional analysis በሚል ነው። I think ከወሎ ዩኒቨርሲቲ ነው የመጣልን። በጽሞና እንድትከታተሉ ትጋብዛለሁ። የቋንቋ ሁለቱንም እየተጠቀምን መቀጠል እንችላለን መሰል። አመሰግናለሁ።
Hello. Okay, so let me introduce myself. I am Amil from Wollo University. I have MPH in biostatistics and epidemiology. Now I would like to present the paper for our conference presentation. So, the mixed milk feeding practice and its predictors among mothers with child aged 0 to 6 months in Ethiopia in general. So here are the outlines of the presentation. So generally as an introduction, mixed milk feeding is just the combination of milk, the breast milk, with the other which is maybe the formula milk or maybe the animal product milk, and other combined with the breast milk, which is called as a mixed milk practice in general, which is recently by WHO and the UNICEF infant and child feeding practice just formulate this measurement. So mixed milk feeding is a global concern because it contributes to mortality and morbidity through since it increases diarrhea and it alters the gut microflora, and also it can be increase the iron deficiency anemia, and also may contribute to increasing the incidence of bronchitis. This is as an introduction. So globally, around 32% of the baby get mixed milk. From this number or this percentage, Africa region has the highest prevalence. Mixed milk feeding ranges from 32 to 65 in Ethiopia, in constantly from different region to different region. So actually, the breastfeeding and formula feeding generally has been investigated throughout the country, but this nomenclature, meaning that the mixed milk feeding is too investigated in Ethiopia, especially using the advanced statistical analysis, using spatial analysis. So now this research has investigated the spatial distribution of the mixed milk feeding, and with it is a spatial predictors. So here are the objective. The methods, as I told you at the beginning, the research was conducted at the national level in Ethiopia among mothers with infant age 0 to 6 months, and the data source was the Ethiopian mini demographical survey 2001-9. The data set was birth record, and the variable, as a dependent variable, we were measuring the mixed milk feeding, which is the percentage of baby aged 0 to 6 months who received a formula or animal milk or both with breast milk. So there is breast milk along, then the other including we can call as a mixed milk. So this measurement was developed by, as I told you, based on the WHO and UNICEF. Here are the sampling procedure. how we are just clean the data using the DHS data set. So we clean the data. First of all, we will download the data using SATA software. Then after that, we will clean the data, especially as it is cannot be analyzed using SATA, since then we will just download, then extract the data to the Excel and then clean with the Excel. Then finally we will insert to the spatial analysis tool, which is ArcGIS, and the other. So we will analyze first as just since it needs the autocorrelation test. First of all, we were conducting the autocorrelation test using a global Moran's index, and we were conducting next hotspot analysis, spatial interpolation, spatial scan statistics, and finally we were just determining the contributor. We were not just predict the variable against mixed milk feeding. Just we were determining the factor which contributed by each region rather than a cumulative using a multi-level or another models. So we simply using to determine the predictors, the spatial statistics. The ethical clearance, since it is openly accessed, we were first request, then the DHS program send us the authorization letter and then download the data set. So here is the result. The spatial distribution of mixed milk feeding practice generally were around 55%, and it is mostly just distributed in Somalia, especially the urban part of Somalia, Addis Ababa, Afar, Amhara, Dredo, and Oromia region, which is here. The first map indicates the red color. Sorry, the red color indicates the prevalence, or sorry, simply the distribution of the mixed milk. So then, mixed milk feeding practice are clustered in urban area of Ethiopia generally. The regions are listed. The problem is not found throughout the country, but there is a specifically found in a specific area of the regions, and also. So this is supported by a study finding, especially those research conducted in urban area like Jimma, Addis Ababa, and Skojam. So this may be because urban area often have better access to milk, other than breast milk. They may have access to easily a formula to buy formula milk and other feeding supplies, and mothers were more likely to be government employees. አሁን ምናልባት ያሬች ሰዎች ካሉ እዚህ ጋር ቻሌንጅ ማድረግ ይጠበቅባቸዋል ማለት ነው። ይሄ ምንድነው የሚባለው ማተርኒቲ ሊቭ አለ አይደል? ማተርኒቲ ሊቭ ላይ የዚህ ኢፌክት ይኖራል። ምክንያቱም most of mothers in urban regions or urban areas are most likely government employees, so they have no time to feed their child, so they need an extra time, meaning that I don't know how can we state the maternity leave time. So it needs research by incorporating this time, how much it how makes different this feeding. So the other, it may be due to limited time for breastfeeding, as breast milk pumping needs time. So here the problem may be pronounced in urban area. This is the region, especially this is concentrated in urban areas, especially in Amhara region around Dese, Addis Ababa, southern part, and some part of Oromia region. It concentrated. So the next part is the predictor. What are the most important variables which contribute for mixed milk feeding, generally, we found that education, residence are the most important factor. Education, especially education in Amhara region, Addis Ababa and Oromia is the most important predictor. Ziga malatum falligo, bedem lamasalal falligo. Generally, education contribute yaragal mixed milk indinor. Yehe problem in bagis mitayo Amara ክልል የተወሰኑ ቦታዎች አዲስ አበባና ኦሮሚያ ክልል ነው ያለው። ሚኒንግ ዛት ያው የተማሩ ያው ይታወቃል። most probably employed ነው የሚሆኑት። እነዚህ employed ሰዎች ደግሞ ይታወቃል ያላቸው ታይም ሶ ይሄ ስፔሲፊካሊ ያለው እነዚህ ሁለቱ ሪጅኖች ላይ ነው። ስፔሲፊካሊ ማለት ነው። ስፔሲፊካሊ ሁለቱ ሪጅኖች ውስጥ ያለው ፕሮብሌም ሚክስድ ሚልክ የሚታየው በኤዱኬሽን የማተርናል ኤዱኬሽን ኮንትሪቢዩት ያደርግለታል ነው። then the next is residence ነው። ሬዚደንሱ አሁንም አርባን ኤሪያዎች ላይ most common ነው። then the next part is occupation ነው። ያው እንደነገርኳችሁ አንድ predictor variable we were considered so specifically ይሄ predict ስናገኝ spatial relationship specifically contribute የሚያደርገው እነዚህ ሪጅን ላይ education, residence and occupation specifically is spatially have a relationship with a mixed milk feeding in those specific regions. Sorry, so this one is the first one is education, especially then I think the northeastern part of Amhara is totally red, meaning that those educated women have experienced with mixed milk. And the next part is totally Addis Ababa has no, has totally red color, meaning that those mothers who were in Addis Ababa, who were educated, have totally mixed milk feeding. እንደዛ ነው የሚያሳየው የተወሰነ ድሬዳዋ totally ኦሮሚያ so the central part of the country has experience of mixed milk feeding. Those mothers who have higher education. And the next part is the richest household. So you know that the DHS program has the economic classification with rich, poor and so on. So the richest individuals household, the household who classified as richest has a mixed milk feeding practice throughout each region. So this may be, so the region is possibly similar with that of the first one, because most of the richest individual may have access to buy any formula milk, since they have many. This one is the next, the urban residence, meaning as I told you earlier, and the next is antenatal care. The most important health service, those individuals who have access to ANC are more likely to experience breast milk, meaning that less likely to experience mixed milk feeding. So what we found or what we concluded in general is mixed milk feeding practice in Ethiopia is clustered in a rural area of totally the Ethiopian regions, and the geographical weighted regression revealed that higher educational status of mother, female household head, urban residents, community level maternal literacy, those variables have an impact increasing the likelihood of mixed milk feeding practice in general, and ANC visit reduce the likelihood of mixed milk feeding practice with distinct space dependent, meaning ያው ይሄ ለሁሉም አይደለም ችግሩ ለማለት ነው። ለምሳሌ አማራ ክልል ያለ ፕሮብሌም ሚክስድ ሚልክ ፊዲንግ ለአማራ ክልል ኮንትሪቢዩት የሚያደርገው ቫሪያብል እና ለትግራይ ክልል ኮንትሪቢዩት የሚያደርገው then also ለአፋር ኮንትሪቢዩት የሚያደርገው ቶታል ዲፈረንት ቶታል ይለያያል። ሶ እነዚህ ኤሪያዎች ላይ ስፔሲፊካሊ ሄደን መስራት ይጠበቅብናል ማለት ነው። So the next what we have, we would like to say that we should have an intervention which is region specific rather than having an intervention in general at the national level. We have to focus to a specific region, those who have a problem with that of their predictors. So this one, what we have all, so I think this is the room for having a seat, yeah?
Thank you, Abel, for your presentation. If Abel is around, Abel Ashanafi, if you are around, please show yourself. You'll be the one to present. Otherwise, we will continue with the discussion with Abel again on the demonstration presentation he presented now. I think we have seen some seems paradox findings that are related with, as recently recent legislation showed that providing maternity for the long period might support women to provide care for their children, including exclusive breastfeeding. However, as he showed, in some areas, despite of the opportunity provided for them, there are limited opportunities for the mothers, or there are gaps in providing exclusive breastfeeding, I think, as he mentioned. So let's give him the stage, and if any question, comments, or suggestion, if you have, please raise your hand so I can give you the chance. The other presenters, yes, Nota. So Abel, you can take the stage.
Okay. Thank you, Abel, for your wonderful presentation. You come with new idea or new paradigm, which is it's shifted from the exclusive breastfeeding to the mixed one. Previously, what we knew is those who are educated and rich people were known to have exclusive breastfeeding, but now your study shifted. The being educated and being rich is to the mixed one. So how do you convince us with these two controversies? Because it looks like reducing of exclusive breastfeeding to the mixed one means it's declining or deterioration of quality of breastfeeding. So how can we convince those who are still educated shifter to the poor quality of breastfeeding system? Thank you.
Thank you. Any more questions? If anyone has questions regarding the presentation he gave us or the description he provided us regarding his findings, you are very welcome.
Thank you, Avil. Just for the sake of clarification, in your presentation you said that the factor which is working in one region is not working in another for these differences. So don't you try to assess the reasons and their significance? Of course, probably if implementers wanted to act on those factors, so hopefully it's better to clearly saying different factors that affect this mixed feeding scenario. So I am thinking that it's very interesting to clearly state such are the factors, and then these factors are not equally working in different scenarios. If you come across with similar pressure on the fixed method, so better to mention that also. Thank you very much.
Thank you. Any other question or comments, suggestions? So let me give the chance to Abel, so you can.
Okay, I would like to appreciate all the questions what what you forward for me. Actually, I understand the paradox, especially the educational status. The existing evidence previously support educational status will, the educational status support to the mothers to have exclusive breastfeeding with their new babies. So actually this research is just simply conducted using statistics. As you know, directly the education is not importantly bring a breastfeeding rather than having a behavioral change. Yeah? The reason behind maybe when we are saying that mothers may have a good exclusive breastfeeding is the reason behind is the behavioral change totally. It doesn't mean the education exactly increase the exclusive breastfeeding. In this region, what we observe is the education, if we may simply look in Afar or Tigray, simply the education is insignificant actually. But specifically in Amhara region, specifically the rural region, the rural area has an impact on mixed milk feeding, especially it increases the activity. What we suggest or what we found for this, what is the reason behind it, especially related to their employment. Because so the classification simply no and the above is not simply here what we classify this. What we observe is the most educated individuals in our classification for spatial predictors. So unfortunately or fortunately, the spatial is detecting that education is importantly contribute for mixed milk feeding. This is for me it is fortunate because it is actually unexpected, but in general for all is maybe unexpected. So this is what we found, but the suggestion behind what we forward is maybe the most educated, maybe the most employed. So the most employed may have a limited time to give their breast for their child. So this is aligned with that of their employmental status and their residence, because those individuals who are in urban is mainly have a mixed milk feeding. That's why we just put as it is, rather than just cooking to convert the relationship as that of the existing study. So this is what I have. The next is just, we know that those variables who are important in Amhara may not be important in Oromia region, actually. So we try to mention those variables which may be important from one region to another or may not be important from one region to another. So since this paper is published online, we can simply read the whole, and I think we may understand that one. This one, what I have in mind. So if anyone to have more, I'm pleased to just accept your comment.
Thank you so much, Abel, for the wonderful presentation. Your study had demonstrated that educational status is positively associated with mixed feeding in Amhara and Addis Ababa. I wonder if there might be other confounding factors that were not measured and that had explained this association. So I would love to hear how the effect of confounding factors were controlled, whether you had used multiple logistic regressions and so on. Because if it were educational status, whether it is in Oromia, Afar, Somalia, an educational status should explain the positive association so that the finding shouldn't be just limited to Amhara and Addis Ababa. Thank you.
Thank you. Anyone else? So let's get back to Abel and let's hear his final words regarding the comments.
Okay, great. Thanks for your nice question. Actually, this analysis is the most exhaustive one because we were trying first the logistic one, and next we believe that the spatial is the most strong. So during the spatial analysis, we are not just going to the last one before that of the most long process, which means we were just trying to detect the confounders using different methods, and also we were checking the multicolonarity, and we were just passing through the most long exhaustive test for whether it is valid or not, based on the scientific procedure of spatial analysis. We were trying that one. But the most important that may affect this analysis may be the uncontrolled, which is actually the behavioral change is not controlled in this analysis. Though that may be the problem behind, because we were not just, actually we have no any behavioral factors in our data, and we were controlled that. So if we may not that, if we made control that one, or we measure that of the behavioral change, which meaning that the behavioral change has no meaning, we are sure that this factor may be true. But if we may just consider and measure the behavioral factor behind, so it may be impossible to say it is totally true and valid. So it may need, since it is paradox, it may need to further questioning, and this may the starting point to ask further. I think this may be my thought to understand what we have done earlier.
Thank you, Abel, and I ask you all to join me, give him a round of rap. So, for the fact that 3 of other presenters who submitted their abstract on health systems yet not appeared, we conclude our session by now, and we really thank Abel for his presentation, and his presentation showed that some issue that we need to focus on regarding other interventions on breastfeeding, especially as Prof mentioned, there are different confounding factors that may not seen in this research finding. However, they have still impacts on affecting women's behavior, on providing exclusive breastfeeding, and you researchers and implementers are supposed to do some more researches and find out what are these factors and contribute for the health service quality improvement initiatives. Thank you so much. So we will have lunch at the same place that of yesterday. So thank you again. Have a nice lunch.